Some confusion for many families over new guidelines about the hepatitis B vaccine, particularly for newborns. Today, a CDC advisory panel rolled back a decades-long recommendation that all newborns get that first dose of the vaccine, and that usually happened within 24 hours of birth. Jessica Hart joins us now with more on the changes and also what folks need to know. Jess.
Jennifer, the panel is saying that decision should be left up to the parents, but a pediatrician I talked with says it's a worrisome decision that could have dire consequences.
Changes to hepatitis B vaccine guidelines sent shockwaves through the medical community.
These should not be political decisions. These should be decisions that are based on evidence, scientific study, and analysis of really what's best for our babies.
Dr. Mark Schleiss is a professor at the University of Minnesota Medical School.
Well, hopefully we will see this clinical practice continue in spite of the damage done by the ACIP vote.
ACIP stands for the CDC's Advisory Committee on Immunization Practices. They were appointed by U.S. Health Secretary Robert R.F. Kennedy Jr. Friday morning, they voted 8-3 to stop recommending a universal hepatitis B birth dose.
If you're a baby that was born to a mother that was tested negative to Hep B, you need to realize as a parent that your risk of infection throughout your early stage of life and probably throughout most of your childhood is extremely low.
Prior to the early 90s, we used an approach of saying, let's find the babies that are at risk. Let's try to immunize in that setting. But we discovered that the incidence of hepatitis B just kept going up. That strategy was ineffective.
Hepatitis B is a contagious liver infection caused by the hepatitis B virus. If it becomes chronic, it can lead to liver failure or cancer.
One of the major driving forces behind immunizing everyone with hepatitis B vaccine at birth to prevent hepatitis B associated cancers.
He says hepatitis B immunizations are known to be safe and effective, and he believes the panel's recommendation is putting babies at risk.
I'm quite sure that by eliminating the birth dose of the hepatitis B vaccine, we will see long-term liver failures. We will see death in a handful of children who are going to be missed that could have been protected by the universal immunization.
He says we might not see the disease and morbidity right away, but if you stop vaccinating, he says the disease will return. Hepatitis B is a 3-dose vaccine. Another panel recommendation is to stop after each vaccination and measure antibodies to try and decide if you need to complete all of the doses. He tells me that recommendation isn't grounded in any science or data, Jennifer.
And there's several other agencies, major agencies that are speaking out against this too, right?
Yeah, exactly. The American Medical Association, the American Academy of Pediatrics, American Nurses Association, just to name a few. I even checked in with our state health department to get their take on this, and they told me that they continue to support newborns getting vaccinated with hepatitis B within 24 hours of being born, Jennifer.
I'm sure it has a lot of parents questioning it. Thanks for breaking it down.